Hello, this is Dr. Eric Bricker, and this is how health insurance works. Today's topic is finding the right doctor. Now, this is meant for like PCPs, primary care physicians, or other doctors where it's not super urgent, and I'm going to give you a very straightforward way to go about finding a doctor that's a good fit for you. So, number one, you want to check to see if they are in network. You want to check to see the location of the practice, and you want to find the gender, male, female, of the doctor that you would like. You would find all this on the insurance website. That is the first place you should go. And you should find about 6 doctors that meet these criteria of being in network, in a location that's reasonable for you, and that are the gender that you would like. Okay, now, once you do that, you take those 6 doctors and you need to weed some of them out. So what you're going to do is you're going to look on Google Maps and Street View. So you're either going to type in the name of the doctor or their address, and you're going to look at the Street View images or just Google images, and you're going to see what the building and the office look like. Because oftentimes you can actually see pictures on the internet of what the office is going to look like. And I will leave it up to you and your judgment if it looks like the type of office that you would want to visit. Many offices look like offices you would not want to visit. So this way you can know in advance. Next, you're going to look at their star ratings online. Now, for doctors that have 1 and 2 star ratings, listen, as a physician, I know you can't make everybody happy. But if you have a whole bunch of ratings and they're all 1 to 2 stars, there's probably something wrong and you probably want to avoid that physician. You also want to look for physicians that have very few ratings. So some will only have 0, 1, 2 ratings. It's like, okay, why so few ratings? Are people just not going to see this doctor? So you want to look at their ratings, and if they have very low ratings or just not very many, period, you want to weed them out as well. Lastly, you want to look to see, and this you would see this on their practice website, you would look to see if they have any solo practice, and only it's Dr. X and only Dr. X. They don't have any partners. You might want to avoid solo practice physicians because they can have a hard time having coverage. So if they themselves are ill, or if they go out of town, or nights, or weekends, or holidays, you want to be able to reach the physician, and they can cover for each other if they're in a group practice. Okay, so by now, you've whittled it down from 6 probably to about 3. Now, you actually need to call. And the reason you have to call these 3 doctors is you have to check for appointment availability. And it really is nowhere else other than actually calling the doctor's office and asking for a new patient visit and when you can schedule that. Sometimes they'll say this week or next week. Sometimes they'll say literally 6 months. Well, if they say 6 months and you want to be seen sooner than 6 months, then you probably have to weed them out too. Now, you also want to think about the attitude of their staff on the phone with you. So typically, if they're a good physician, they are probably not going to tolerate having an employee that has a bad attitude on the phone. So if you talk to somebody who's got a bad attitude on the phone, it's not 100%, but that might be a doctor's office that you want to avoid. So this process is not perfect, but I have found over the years that this is a helpful way for getting started in finding the right doctor for you. And that's how health insurance works.